we are on. Okay. Could you please state your name, title, and company affiliation?
Sure. My name is Linda Carr. I am the COO of CubeChain, one of the first blockchain solutions companies. We've been there. CubeChain's been around since 2015, but I've only been there for about a year and a half.
Linda, can you tell us a little bit about what you were doing before that, kind of your history in blockchain
Sure,
and healthcare,
sure.
and how you've gotten to where you are?
So I have been in the IT industry since '85, back in the world of DOS, all the way into building systems on 386 and 486, then continuing on into working with Microsoft. I was one of the first 100 women in the world to get my MCSE. Additionally, I have certifications from Cisco, EMC, and VCE. I'm one of the few V-block engineers in the world. I am a technical person. I have been building systems for many, many years. I built Disney Online from scratch. I worked on the White House communications systems. I built Sony's initial website when they first came out with the PlayStations back in the early, or actually late 90s. Have been moving people to the cloud. I have a book on the cloud that I wrote in 2012. And I have a book on blockchain that just got published in October of this year, 2018. So my background is such that I've been watching the internet and been working within it literally since at the early days, to say the least, and then had the opportunity to go from, as I said, pre-HTML to internet to ISPs to cloud to now the natural progression is blockchain, because blockchain is, depending on your background, is basically the next layer of the OSI model, where you've got from the frame all the way up and out onto the internet. But in this case with blockchain, the immutability of how a blockchain works, and the fact that you can't just throw things in there and take things out without someone, one, recognizing it, and two, saying that's not allowed and kicking you out of the chain. Blockchain within healthcare, we have been working in for about the past year with military health systems. Was one of the first ones where we put together a wallet in order for the military folks to be able to have access to their electronic health records with a multi-sig wallet that they could use up to 7-factor authentication to include username, password, fingerprint, NFC chip. Our founder actually had one implanted in his hand, and all the way up to what's called geofencing, where based on where you are located and your latitude and longitude will allow you to log into a system or not. All of those are there, and we have found that within the healthcare industry, the need and the ability to use blockchain, it's like it's the perfect place to use it. You can put what's called off-chain and on-chain data. Off-chain allows for individual providers, individual hospitals, those types of things, to store very, very detailed records, and then to just redact a certain amount of that information, or filter it, as some may say, into a public blockchain that would take away all the PII. So you've still got the results, you still know that it's someone that within this particular age range, that particular female, male, that type of thing, what type of background that person might have, without someone being able to backwards engineer who that person is, where they live, that kind of thing. So blockchain within healthcare has got some significant value, and we at CubeChain have already implemented some of it and are implementing even more with a couple of very, very large customers.
What do you think, bouncing off of that, what do you think are some of the most pressing issues right now that need to be solved for blockchain in healthcare?
So in order for blockchain to be widely utilized within healthcare, somebody needs to decide whether they're going to, not someone, but a group needs to decide what kind of information will regulators allow to be put into the blockchain, because healthcare is very, very regulated. So therefore, before we can make a full-on press, basically, to put stuff out there, we need to be sure that the regulators are going to allow us to make use of the information that we put there. For example, if we do a consortium and we say the consortium is all of the insurers, so we've got the Anthems and the Kaisers and the United Healthcare and those guys, each of them has their own information about patients, right? So if that information is allowed to be aggregated so that then actuarials could actually say, okay, now not only do I have the data from each of those insurers, but now I have the data across those insurers, how much of that are the regulators going to allow us to use for drug testing, drug trials, just even helping a patient manage their claims when they go from one place to the next. You know, say for example, you work for one employer and they have Anthem, somebody else, they have Kaiser. How do I get my data that I had with all the doctors that I had at one place to the next? You know, being able to put that onto a blockchain and being able to be controlled by a patient would be hugely beneficial to the patients. Some of the challenges of that though, and this is important, who is responsible for storing that? That's a big deal. Like, where do we store it? And that's where I think that a consortium could be greatly utilized for everyone to share in the cost of the storage of all of that data. Somebody has to store it, right? Somebody has to back it up. And it is not the responsibility of one or the other. Whereas if you put all the data for a particular patient into one place and everybody was sharing in the cost of that, it could greatly enhance the ability for providers to provide a better level of care, because they knew what had happened to the person 10 years ago, 15 years ago, 20 years ago. Whereas right now, it's disparate. It's only if that particular patient decides to keep track of his own stuff that he actually has that history. And that history can be hugely beneficial. Not just for that patient, but that patient's family even, too. So.
What was it about blockchain as a technology that initially piqued your interest?
So I've been a technologist for 30 years. So it is the next wave. Basically, for me, it was the next wave. Having been involved in, building out systems, back in the 80s, I actually was lucky enough to work with Oki Data on some of the bitstream fonts on how to actually print things. Today, people don't even think about that. But when we were first designing laser printers, you had to figure out how to get the font to fill in correctly, depending on the sizes. So that was then. That was in the 80s. Today, we're so much further than that. You know what I mean? If you consider even the server that we built, that we within CubeChain have built, the ability to be able to lock down a system so that an application, as well as a database, as well as a blockchain, can all sit on the same secured server and be able to be run at thousands and thousands of times faster than it was ever before. You know, the ability to be able to lock down and do what's called air gapping information, because you've got some of it on an SSD, which is very fast drives. Other might be on an NVMe RAM, which is a storage with memory together, or it may be on a little SD drive that you've got, plugged into the front of a server. Each of those can have its own operating system and its own speeds at which you allow applications to run. You can control it.
Being a technologist, then, this will be awesome coming from you. As a technology, where do you see blockchain in terms of maturity today?
It's still pretty new. It's not as new as some folks think, because it has been running. The military's been running it for a little while. We have a couple of customers within the military that have been using it. But I think within healthcare, specifically within healthcare, I think that it has the ability, and this is something I said today when I was talking, to take the HIEs, the Health Information Exchange, take that and add to it the ability for doctors to have access to patient information without knowing who the patient is. Being able to anonymize the data and put it into a blockchain so that then it can be used for doctors to say, okay, this person with these characteristics was given this medicine and this was the impact. That would be just one. Another one would be a place for research and for drug companies to say, okay, let's reach out to this group of patients, and that group of patients we have a way to get to them without encroaching on their privacy. Those kinds of things. And I think that the ability to better serve the patients and store the information and let patients control who sees what is definitely there with blockchain.
Looking into 2019 and beyond, what excites you? What are some things that you want to see happen?
I want to see some consortiums actually truly come together that aren't going to be just pure costs. You know, somebody who wants to make a buck. I want it to actually do what it's intended to do and to benefit the patients. And I think that the consortiums put together correctly with the right governance, with having one group that's responsible for determining governance, somebody else who's responsible for managing the technology, and having them come together and decide what is the format of data that we're going to put on blockchain. What kind of data are we going to put out there? I think that those consortiums can basically peanut butter the costs across all of them, and everybody benefit from it, so that even places like Cincinnati Hospital might be able to handle a small amount of money if they have to, and still be able to have access to the same things as they have maybe in Palo Alto or Vanderbilt Hospital. Each of those has access to that same data. Imagine if the doctors could easily type a search for something specific and come up with and be able to filter down into the types of information for a patient to see what kind of impact a drug had, or certain behaviors had. It would hugely help. The whole thought process of, say for example, and this is something that I've thought about for a while, the ability to do organ transplants more quickly and find someone that matches all the criteria more quickly, and you could quickly get things. I know there's databases that do it, but imagine being able to have things that were uploaded more quickly. For example, God forbid, but someone get hurt in a bad accident, they were an organ donor, it immediately got put up into a system. Because of the speed of transactions for some of the blockchains, instead of it taking time for a batch job to overnight maybe upload, it could be there in seconds. And then someone who needed it in another state, in another, maybe even another continent at some point, would immediately be able to have access to the information, and we could get things to people more quickly.
That's a pretty amazing example. When you think about somebody who is going to be picking up a collaborative book such as what's being put together by HIMSS, just in conclusion, do you have any thoughts or comments that you would want to leave with a reader, whether they're on the more elementary side or the really in-depth understanding side of for specifically blockchain in healthcare?
Okay, so the healthcare, one of the things is that blockchain is just another protocol. It is not the only protocol. And I want folks to understand that blockchain is a ledger technology. That's what it does. You're basically taking a ledger and putting it into an environment where if anyone tampers with it, you know. So you create that immutability. That's a great, great piece of information to know, so that when the data that you see there, you know has been validated, not once, not twice, but by, depending on how many nodes are a part of the blockchain ecosystem, you can have thousands of them. Second, don't be afraid to try it. You have to get your feet wet. You know, it's like the Wright brothers. Somebody had to try to fly. You know, so you need to basically take the leap. Don't put it in something that's going to be super mission critical, but put it in something maybe in your claims processing. You know, try to pick a specific use case. Say, for example, it was your physicals. You wanted to put all your physicals that were done by a specific company. Say, for example, you had a Kroger's or a Abercrombie and Fitch, you know, and all those people needed their physicals. Why not track that with blockchain and be able to track and see that everybody got their physical and that it got paid? And if you use blockchain and smart contracts, you have the ability to, one, save yourself money, because you're going to reduce the amount of resources that you're going to use to actually process all of that. Because once you tell somebody, here's your voucher to be able to go get a physical, they go get the physical, you pay it automatically to that provider. Now you've tracked it in a blockchain. Your auditors are happy because they know who went where, and you know where the money went, and that it got given to the right people. So you got to start someplace. Start small. And then think big, though. Think big, because you've definitely it's definitely going in the right direction.
Awesome. Anything else you want to add?
I don't know. I told you already that I wrote a book on blockchain. It's out there. It explains to people how to implement a blockchain within their organization. It gives them the decision criteria, helps them figure out there's 7 different blockchains that are in it. It's got 4 or 5 different use cases, not just healthcare. and it's got a very large glossary that explains all the different pieces and parts, like Turing complete, Genesis block, 51%. All of those are things that people first starting out into the blockchain world don't know and don't know who to ask. So it breaks it down.
Awesome. Thank you so much for your time.